Hello Margaret, I'm Molly, your physiotherapist. What we're going to talk about is some exercise programmes that you've been referred to because of your recent hospital admissions. Hopefully they're going to help manage your COPD and help you getting back to what you've been struggling with basically. So to start with, you'll have an assessment session where you'll do a couple of things. You'll do a 6-minute walk test, that's to measure your level of fitness, and then you'll do a couple of questionnaires, that's a bit more about how you're managing your day-to-day life and your quality of life. But these are nothing to worry about. All it is to show us what level of exercise you'll be doing in the class. So don't worry that you'll be expected to do too much. We'll be setting the class for your level of fitness. And we'll use these to set some goals and targets as well that you want to achieve by the end of the class programme. We'll do these tests again after the exercise programme, see if you've improved, which can be quite nice for you because then you can see if the exercise has benefited you and by how much, which can help motivate you to keep going with the exercise as well. The programme will be an 8-week programme. You'll have 2 sessions of exercise a week. They'll be an hour long, each of them. There'll be a physio there and a physio assistant, along with, in the group there'll be about 8 or 10 other people with COPD. So it's quite nice that you can socialise and talk about what you struggle with, and you can sometimes pick up tips of how other people cope with problems they have from their COPD. We'll also encourage you to do exercise at home as well for one session, but this is when you feel confident in doing so and comfortable. We don't expect you to go off straight away and feel happy to do a full exercise circuit at home. So what you need to make sure you bring with you as well is some comfortable clothing that you can move around in, and some supportive shoes, just some trainers or something that ties up. The structure of the exercise session will be, you'll have a warm-up, this will get your heart rate going, prepare you for the exercise, do some stretches, try and help prevent any injuries. And then the actual main body of the exercise, it will be a group circuit, so you'll move around different stations doing different activities. It'll include both aerobic exercises, so you'll have things like on the bike, or you might be walking on the treadmill. But it'll also include strengthening exercises, so with a bit of resistance, so you might use some little weights, doing some arm exercises, or you might be doing other exercises to help strengthen your lower limbs as well. There'll be rest stations as well throughout, and if you do ever feel too breathless, you can always have a sit down and a rest, that's not a problem. In the rest stations we might help you with using some breathing positions which can help reduce your shortness of breath. You can then use these in your day-to-day life to help you cope with you if you do become short of breath. And then to finish the session there'll be a cool down. This is just to bring your heart rate back down and just finish off the class really. If you'll need to bring with you any medication that you might need as well, so your salbutamol inhaler, or if you do become really breathless and you feel you need it. And then because of your painful knees, if you make sure you take your paracetamol, which you take for that day, on the day regularly, so that to try and just control the pain a bit before we do the exercise. But the exercise should actually help with your arthritis in your knees as well, so don't worry about it making it worse, but we just want to manage that pain so it doesn't hold you back. There's a lot of benefits from the exercise classes. It'll hopefully increase your fitness, so hopefully it'll help you walk a bit further outside, help you get to do tasks on your own a bit more. So when you're visiting friends, hopefully we'll try and get you to do that independently, because I know you enjoy visiting your friends and at the minute you're having to go with your husband, so hopefully we'll try get you independent in doing that. Hopefully exercise classes will help reduce your shortness of breath, but also help you cope with it as well if you do get short of breath by using the positions, like the breathing positions. Hopefully it'll increase your strength, so I know you've become a bit more deconditioned, a bit weaker, so hopefully building your strength up will help you do tasks at home, like walking up and down the stairs. Hopefully it'll help with just daily tasks as well, like cleaning, cooking. And hopefully exercise can help manage your osteoarthritis, like I said, in your knees, so hopefully you'll gain some benefits in that way as well as it can help manage any anxiety and depression as well with exercise. Having a long-term condition, people can get quite down with it, and especially in a group and you're with other people, it can often help. And with the anxiety, people often become quite anxious, and it becomes a cycle with your COPD. You're worried about doing exercise, you get anxious because you're becoming breathless, but actually we want you to become breathless. This can help. So hopefully the exercise classes will teach you what limits you do have, so that you feel confident that you are able to walk a certain distance at home because you've been able to manage a certain distance on the treadmill within the classes. So hopefully it can help with your anxiety like that, and help with walking distances outdoors as well. So hopefully you can maybe walk that bit further on your own, not needing any help. And hopefully it'll just overall improve your quality of life by increasing your independence. And then for the long term, we want you to keep doing the exercise so that you maintain the benefits. So after the 10 weeks or 8 weeks of the programme, if you keep doing exercise at home, like at your local leisure centre, or even if it's just doing that little bit extra, so you'll walk to a couple of bus stops further down the street instead, so you're just keeping to maintain the benefits that you're getting. And hopefully it'll help yourself manage your COPD as well, so that you know what to do when you do become breathless, and increase your respiratory muscle strength as well. So I know at the minute you struggle to clear your secretions when you do have a chest infection, so hopefully by strengthening your muscles it will help clear that as well. And hopefully it'll help yourself manage using exercise to reduce your hospital admissions overall, which no one really likes to be in hospital, so that'll be a big bonus if you can do that. Now I think that's everything, so if you've got any questions? No? Okay, well this is just some information on a bit more specific on the exercises that we'll be doing, so that you're aware, but we will change exercises each week, so to vary it a little to prevent you getting bored, but that's a variation of different exercises. So we'll see you there. Thank you.